Greetings, this is Timothy Youngs, the Digital Apothecary, and today I'm going to be talking about different ways that we can basically monitor and track adherence, or roughly more or less what are we doing these days. So I'm going to give some history over some different tools out there, but to start with, let's look at some ways that we are currently trying to track adherence. Nowadays, I would say in the clinic or just through clinical practice or different things that people kind of give out to help out patients. So, in the past video, I talked about different ways medications are dispensed from the pharmacy, and the ubiquitous amber pill bottles are probably one of the biggest ones that we see out there. Now, there's different ways that you can handle this for patients instead of them having, let's say, about 10 different pill bottles, is maybe giving them a device to kind of track when they're taking the medication. So there's two ways you can do that. We're kind of seeing, so these are kind of called pill toggles. So what you do is you would actually rip off this sticker and you stick it here, which is always a criticism for mine, because then when the pill bottle is done, like, do you just throw this away and you have to buy new ones? But anyway, as you can see, there's 7 on here. And I guess if you were taking a medication twice a day or 3 times a day, you could attach more. But I think it would get a little cumbersome. But what you're supposed to do is every time you take it off a dose, you basically hit the toggle. So I took my dose Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and then looking at it, okay, and then start again for the week. It's low tech, but that's one option. Some other things are you can basically put a timer on. You can buy these. Again, there's different ways you can do this. Some of them have a little sticker that you then basically stick on top of the pill bottle, and you would just basically set this up and basically program when you want it to go off. So you choose a time and they'll start basically buzzing and making noises and say, okay, come on, open me up. Otherwise, what people can do, and you see this all the time at health fairs and such, is giving out little, basically, boxes. Pill boxes are very ubiquitous. I mean, I would say these things are used a lot. I see them all the time. Since I've been in pharmacy school, since I've been a pharmacist, since I do clinical practice, I see these things used a lot around different medical homes. I see them used at patient homes. I see family members going in and doing this. I see pharmacies, and especially independent pharmacies, they will basically offer to fill these things and then give them to a patient. They come in different ways. This is a very, very small one, just as an example of how tiny it can get. So, like, a few tablets could fit in here. But they can be huge, and they can be basically 1 week supply. You could also be, and usually they're a week supply, but it could be like once a day. You may have 2 for morning and night. You can even get up to 4 times a day. And that comes very similar to those blister packs I showed you in the past as well. So these are kind of like low-tech solutions to track adherence, as I've mentioned. But there are other ways that we currently can track adherence. So let's bump into that and talk about that now. So as I mentioned, there's different ways for us to basically measure adherence. So this is a kind of a little good publication I like to go over in terms of what are different ways that we can track adherence. And this is from New England Journal of Medicine. This was published back in 2006, and I would say it still stands up to time because there's a lot of things that we still do that's relevant. But I think there's also things that are coming up that I think are big game changers. So let's start with the current focus. There's the indirect ways that we can basically measure adherence. One thing you can do that's very simple is you could always just take a pill bottle, and if we talked in the past, if we know a person is getting a 30-day supply, and there are, let's say, suppose they take 1 tablet a day, there should be 30 tablets inside this pill bottle. So if you have someone to come in for a 2-week visit, you could hypothetically say they should have anywhere between 14 and 15 tablets left in there, depending on when they took it that day or the night before. So you could say, bring in your medications, and we will basically just dump them out, and we will count them and see how many remain in there. And ideally, if they're at the mark that they're supposed to be, if they're following directions, then you could say they're adherent. And if they're not, then you would assume that they're not being adherent to the therapy. Now, there's different issues with this that I've come across. One is I love it when patients keep the same pill bottle, and what they'll do is every time they get a new prescription, what they'll do is they'll dump it into the old pill bottle, which negates this effect. And thus you can't do this. I've been told this by patients a lot. The other thing I always look is, even what is the pill bottle? I've seen patients say they're using the same pill bottle as 2 years old. And then you start asking questions because is that SIG or the direction still correct, for instance? And that's always troublesome and concerning. So that's one issue there. The other thing is, let me be honest, I think all clinical people have seen this. Patients will count out and discard because they don't like knowing that we're going to go in and count them. If they start seeing that happen, they don't like that negative feedback. I mean, it's always a motivational component. You want to be open with the patient, but some patients will just start counting out medications and throwing them away when they get to the clinic to basically say, oh, they want me at this. I know they're going to count them, and I don't want to feel bad. I don't want to make myself look bad. And that kind of negates a lot of things. So there's a lot of subjectivity, and that's what I'm going to come back to, subjectivity versus objectivity for measurement and tracking of adherence. The other thing is you could do basically prescription fill rates. And this is quite easy these days because what you do is there's a medication claim that occurs for a billable event for a medication, such as through their insurance. You can go back to the insurance company, look at the claims data, and say, so if it was a 30-day supply or a 90-day supply, they should be getting a refill within those 30 or 90-day supply. And if, as long as they're within that window, you assume they're picking up the medication, then they're probably taking it. Now, I should say this, even I've had my own family members that come across this, they'll get these refills, and that doesn't mean they're taking them, they're just buying them because they're being told your refill's up, so they go get them. The other thing is, you're assuming, again, that just because someone's buying the medication, they're taking it all the time. It's very subjective from that perspective as far as I'm concerned. So it's an easy way. There's a lot of data you can crunch from that, but it doesn't necessarily get to the root cause saying whether or not someone is actually truly taking medications, only that they're buying the medication. The other thing to consider is that there's a lot of people who will buy medications cash price. So what does that matter? Well, if you're taking claims data from an insurance company, but you're not basically able to access if they purchase a medication through cash or through a debit card, well, then that makes an issue. So where might this be coming up? What if they're using a drug coupon? What if they are paying cash? What if they're going for a $4 list at Walmart, for instance, and buying their lisinopril or something? You're not going to see the claims data. It's not going to pop up. So that kind of negates this right there and then. The other things is kind of like this electronic medication monitor. This is a little bit older, but that would kind of refer to like some older smart technology they had back in the early 2000s and even 1990s. The other thing is you can look at physiological markers. I mean, I do this all the time. You have a patient that takes antihypertensives or basically medications for their heart rate, even for glucose control. And you can assume you go in, you take their test, you take their vitals and such, and then not a goal, you start asking the question, why are you not there? Why is your, you came in today and your blood pressure is still high. Did you take your medications? No, I didn't take it this morning. Okay, well, that might be why, but now I'm in a hard place. I've scheduled a visit for you, come and talk about your blood pressure, and your blood pressure is not controlled, but you say you didn't take it this morning, so does that mean that do I want to change therapy? Do I just want to keep watching? Do we revisit in 2 weeks, 3 months? You see why it gets a little hard. Patient diaries relies a lot on the patient to keep a diary, to write down stuff. I mean, I think this has gotten a lot better nowadays. Asking caregivers whether or not they know what's going on. So this current focus, this is where I see a lot of like different things. We're trying to do these whole internet things. We're trying to apply smart pill bottles, smart pill dispensers, mobile apps to kind of replace all this stuff. And I think that's seeing some benefits. Other things that we could do, and these used to be very labor intensive, would be like directly observed therapy, where you have a person that you just watch them swallow the medication and you verify they actually swallowed and took the medication. Other things are metabolites or the drug in the body. And some people will say this, this is definite. This is always going to show that whether or not someone's taking their medication. I actually throw back what I call basically the whole dentist problem. Let me ask you this. How many of you guys brush every day? Most likely, yes. How many of you floss every day? This is whenever I ask an audience, the answer probably goes down to about 25% of people. So, again, it comes back to this idea. If you know you're going to have a blood exam coming up and they're going to test you for concentration in your body, what you'll see is a lot of people actually start taking the medications a few days before they get the blood work done, because you only need to reach so many doses before pharmacokinetically you get to a concentration that's going to be present in the blood system to actually detect this and make it verifiable. But it doesn't mean it's all the time. And to be quite honest, no one's going to be doing blood testing for someone for basic adherence in their body system every day. It's not practical and patients will hate you. So that's not going to happen. The other one, along with directly observed therapy, is this whole bioadjustable sensors and medications. When you swallow them, you can actually detect them going off. Using smartphones and there's cameras to detect them for remote monitoring. So I think these are kind of promising. The other thing we see is basically patient questionnaires and self-reports. These have been used a lot. These are actually used also to quantify and to actually verify whether or not people are being adherent, especially with interventions I'm seeing right now in clinical trials. So what are they? This is a free study. I was trying to find one. So if you're listening to me talk and you're trying to pull up literature and you don't have access to actually a library, or you don't want to purchase them, this one was free online from what I could find, so I think it's a good little review. So I'm going to talk about a few of these. One of the biggest ones is the study by Murowski and colleagues. This was published back in the 1980s. It's an 8-item questionnaire. And again, this goes back to a lot of subjectivity you put on the patient to answer and verify whether or not they're taking medication. So if we look at this 8 items, and you have to score them based on no or yes. Number 1 is, do you sometimes forget to take your whatever medication? Like let's say, do you ever forget to take your metformin? People sometimes miss taking their medications for reasons other than forgetting. Thinking over the past 2 weeks, were there any days when you did not take your metformin medication? Have you ever been cut back or stopped taking your medication without telling your doctor because you felt worse than when you took it? When you travel or leave home, do you sometimes forget to bring along your metformin? Did you take your metformin yesterday? When you feel like your metformin is under control, do you sometimes stop taking, your health disease? When you feel like your diabetes is under control, do you sometimes stop taking your medicine? Taking medication every day is a real inconvenience for some people. Do you ever feel hassle with sticking to your blood pressure treatment plan, for instance? And basically then, how often do you have difficulty remembering to take all your medications? And then they would circle this. And then based on how many they say yes or no, you would then rate them as being, on a score, adherent or not adherent. So why don't I like these things? Because I am critical of them. I do think they're a good baseline. I mean, this thing has been validated a lot. This has been used in a lot of clinical studies and such. I'm not saying this is bunk. I'm not saying it's junk. What I am getting at, though, is what you have to figure out is, what are some limitations of this? For me, it's recall bias is one of the hugest things. And you come back to this whole thing about subjectivity and objectivity of measurements. If we go back to what I was talking about previously of measuring adherence, a lot of the stuff out there is subjective. Directly observed therapy is probably one of the only objective ways for us to track and make sure someone actually took a medication. And I gave you some examples why that does matter even for us in clinical practice. So coming back to this, just giving this questionnaire to people, when I've done this, turns into a lot of patients being, I'm not sure. If I ask you, what did you eat yesterday? If I ask you what you ate 2 days ago, can you recall perfectly? How much water did you drink in the past 24 hours? Things like that. I mean, it's very tough. We live busy lives. Patients are no different. They have a lot of other stuff going on too. So I try to always give them that benefit of doubt. And that's always a big thing for me. But in this case, how often did you forget to take some of these medications and such? And that recall bias, I think, makes things very difficult. And this is more or less a tool to help guide you. It's not going to be vindictive and say, yes, this is true and this is not. And also it could be subjected to time periods and could wax and wane. And these things are all kind of like that. So that was the Mercy score, also called, you also hear MMAS8 is another thing. Some of the other ones I've seen here, I'm just going to scroll down. Mars. So Mars is another one. And this one is basically, do you ever forget to take your medication? Are you careless at times about taking your medication? When you feel better, do you sometimes stop taking your medication? Sometimes if you feel worse when you take the medication, do you stop taking it? I take my medication only when I am sick. It is unnatural for my mind and body to be controlled by medication. My thoughts are clearer on medication. By staying on medication, I can prevent getting sick. I feel weird like a zombie on medication. The medication makes me feel tired and sluggish. This one was also targeted more towards the psych population. But as you can see, you can use this basically to get to calculate it out. And some of these actually, the points vary depending on what they say yes or no to, as you can probably tell. Another one that, let's see what's on this one. I think it was towards the bottom. No, it was not. There's a few other ones out there, but I think those two are ones I've heard about a lot. But this kind of goes into details. But if you start looking through this, you can see they all ask very similar questions like, do you ever miss? Do you ever not want to take it and such? And the reality is, if you think about it, medication adherence is multifactorial. It can be intentionally adherent or not intentionally adherent. Intentionally adherence could be, I don't like that side effect, I'm not going to take that drug. Other intentional could be, this medication basically gives me a side effect that causes other issues, or even like knowledge based. You get a little pamphlet from the pharmacy about medication, you look it up online and you say, oh, I don't like that idea, I'm going to stop taking it. I'm not going to take it, I'm going to wait till I see my doctor or someone else to tell me to take it. And they may wait a while when they should have been taking that medication. One of the best examples is people who have a myocardial infarct or a heart attack. They're supposed to go on antiplatelet therapy, especially if they get basically catheterized and they got stent placed. And they'll say, oh, I don't want to take aspirin or clopidogrel because it increases my risk for bleeding. And then they basically reclot. And it's like, what just happened? And they just didn't take it because they were afraid of bleeding, when the reality is they needed that medication to stop them from reclotting and having another repeat event. I mean, these are things that happen. And the other thing is, non-intentional could be, maybe I can't afford my medication, so I can't even take it. Or non-intentionally, English is not my first language. I was instructed and someone translated something to me, but I didn't really understand. I didn't want to ask you too much. I go to the pharmacy, it's printed in English, I go home, I think it says takes it once a day, and it actually says take it twice a day. So that would be like a non-intentional non-adherence. So, this is very multifactorial, it's all over the place. I really am very gravitated towards this idea of this technology stuff that I'm going to start reviewing, just because I like the premise that basically we may get to more objective measurements. So if you like this idea, keep an eye out. I'm going to be posting more of these videos coming up. And this is Timothy Young's the Digital Apothecary, and have a good night.